So I understand that you work at a neurosurgeon's office.
Yes, I do. I work for Dr. So, and I've worked for him for 25 years.
So what is your guys' protocol for patients physically coming into the office during COVID?
Well, first, when the patient schedules the appointment, we go over a list of questions. And then when we call to confirm, we go over the list of questions again. And some of the questions are, have you been fully vaccinated? And either they're going to answer yes or no. The other one is, have you been tested for COVID-19 in the last 14 days? Mm-hmm. And, they either say yes or no. And if they say yes, then we want to know what the diagnosis was, if they actually had it or not. And then we also ask about, if they've had a fever and if they had any of the symptoms of COVID, like dry cough, shortness of breath, stuff like that.
What precautions do you take for employees that sanitize in the office?
Oh, we have a lot. First of all, in the medical field, we're already gloved and masked because we've been doing that for years. But we also have a plastic barrier between us and the patient in the waiting room. Mm-hmm. And then in the exam room, the doctors actually has two masks. They have an N95 mask and then they use another mask over it.
How do you ensure that the virus can't spread throughout the office when surgical procedures on the mouth are being done?
It's a good question. We try to limit it as much as possible. We do have a machine. It's I'm not sure what it's called, but it's like an evacuation machine where it sits right under the patient's mouth, which sucks all the air that's around the patient while the doctor's drilling, so it keeps all the aerosol away from coming into the air.
Do you have to take any further protocols that for patients with compromised immune systems? If so, what are these protocols?
That's a good question. Usually we will go based on what the doctor's recommendation is for that particular patient, just like we would even before the pandemic. If a patient came in with immune compromise, then we have to confer with their primary care physician and also their specialist, whether it's a kidney disease or heart cardiologist. We would get their recommendations before we proceed with any type of surgery. That still would go for COVID for patients that could be at a higher risk for COVID. They might talk to their physician first and say it's not recommended for them to do it right now if it's just an elective procedure.
How often do you usually work with people like that have compromised immune systems on a daily basis?
It's fairly frequent, to be honest. We have a lot of them, but usually the pandemic with the immune compromised patients, we don't have any different protocol than we would for anybody who comes in the office. The only difference in protocol we have with compromised patients are what the doctor, their physician or their specialist is asking Dr. So to do before we perform any surgery, which we would have done before the pandemic ever started.
Well, that's really good. Has your office had to acquire any new machines or filtering systems to help keep the air clean in the office? If
Yes.
so, what are those?
Yes, we do. We have it's called I think it's Med Air. It's a air filter machine that we have in the front office, and we have it in each individual exam room. We have it in the surgery rooms and also in the consultation rooms.
So you guys are pretty well insulated.
Oh yes, absolutely.
In the whole office. And what if a patient comes in and you check their temperature and they have a high fever? What do you do when that happens?
Well, if they have a high fever, first of all, depends. Sometimes we got that during the summertime. People will come in when it's really hot, and the first time I take their temperature could be higher than normal, a little bit above average. If that's the case, then I just have them sit in the air-conditioned office for a few minutes, and if it's still high, then we're going to have to send them home, and they're going to have to see their physician or come back when they no longer have a fever.
Mm-hmm. And what happens when you call a patient and somebody says that they have like an allergy cough, but they had tested negative for COVID? Do you still let them in? How can you determine if somebody should be seen?
That's a good question. There's a list of symptoms that COVID-19 has, not just cough. There's other things that go along with it, with fever. So if the patient just has a cough from allergies or like a runny nose from allergies, then we can see them as long as they come in. They still don't have a temperature, and they haven't had any other symptoms that's related to COVID. But also, if they do, let's just say that a patient did have COVID, then they have to wait 14 days after their last symptom before they can come into our office, and we need to get a negative test.
Do you guys actually go through a whole quarantine process and everything, like to ensure that before they even set foot in the office?
Well, yeah, they would have to do that at home, just like the CDC
Just like
recommends.
everybody else.
Yeah, just like anybody else. Yes, that they would go through that, and usually they would just self quarantine for everything, because they would need to be at least 14 days of no symptoms before they go out.
What precautions do you take when patients are leaving your office, being so vulnerable to like recovery? What do you guys do to prevent them from retracting the virus after the fact, like in their recovery, to make sure that they're okay after the surgeries?
Well, the recovery after is really going to be, it's just really common sense. Like once they get home, they're going to have to, just stay in the house, because once you remove they're going to be a little bit more susceptible to things out there from the surgery, for their bodies repairing themselves. So, we do ask them to stay home for the first few days until they're feeling better.
Are you letting family members come in with patients, or do you have them wait outside?
In the beginning, we had them wait outside, and we just only would see the patient unless the patient was underage and had to be accompanied by a parent. But now, the way our office works is, if a patient could come in with, one or two people, but our office only allows that patient and their family members in the office in at one time. We don't have two different patients in at the same time. They're completely separate. Once they leave, we wipe down everything, we sanitize everything, and then the next patient would come in. And what our office has done is we reduce the amount of patients we see every day, because we take longer to clean up before each patient, to prepare.
Okay, so it's a very rigorous and
Right.
strict process.
Right.
Is there anything more that the doctor has to do for his own equipment during COVID? Does he have to do anything special extra for himself after working in everybody's mouth?
Well, the one thing that we do, especially Dr. So does, is when he comes into the office, he's wearing his street clothes, he puts on his scrubs, and before he leaves the office, he takes off his scrubs, he puts it in a bag, and he wears his street clothes home, so he doesn't bring that home. So if that's what you're asking, I'm not sure if that's...
Yeah, anything like that, really. What happens if someone in the office comes down with COVID? Do you guys shut down or quarantine
Yes,
for a period of time?
if somebody actually came down with COVID in our office, then our office would have to shut down, and we would have to quarantine for 14 days.
Oh, okay, so you guys would actually have to stop operating.
Absolutely, we'd have to stop operating completely.
All right, well, I really appreciate the interview, and thank you very much.
You're welcome. Thank you.